Hello, everyone, and thank you for joining us for today's Science of Sleep Facebook Q&A. My name is Dr. Mariska Brown, and I am the director of the National Center on Sleep Disorders Research at the National Heart, Lung, and Blood Institute at the National Institutes of Health. The Science of Sleep series is a three-part series designed to explore NIH research on the impact of sleep on our health at every age. It's co-hosted by the Eunice Kennedy Shriver National Institute on Child Health and Development, the National Heart, Lung, and Blood Institute, as well as the National Institute on Aging. Our topic for today is sleep health for children and teens. It's my great pleasure to be joined by Dr. Lauren Hell, who's an NICHD grantee. Dr. Hell is a professor of medicine, population and preventative medicine at the Renaissance School of Medicine at Stony Brook University in New York, and is the founding editor-in-chief of the Sleep Health Journal. Dr. Hell is also the chair of the board of directors at the National Sleep Foundation, and today she will be sharing her expertise on the social patterns of sleep and how they contribute to health disparities. Dr. Hell, welcome.
Thank you, Dr. Brown. It's such a pleasure to be here and an opportunity to share some insights from my NICHD funded research on the science of sleep in child and teen health, and really any opportunity that I can to reiterate how important sufficient restorative sleep is for the optimal functioning of the human body. And that includes performance on daily activities, sports, academics, learning, psychological well-being, and of course, physical health.
Thank you for that, Dr. Hell. So before we get started, I want to let everyone know that we will be sharing resources and links on Facebook throughout today's discussion. I also want to be clear that the information that is shared today is not medical advice. We are sharing insights from the latest research as well as resources on this topic. If you need medical advice, please speak to your medical provider. As this is a quick Q&A, let's get started. So, sleep deprivation is an epidemic, including amongst teens. Can you elaborate on what this means?
Absolutely. Teens are some of the hardest hit age group in terms of not getting enough sleep. Experts have recommended that teens get between 8 and 10 hours of sleep per night for optimal functioning. And right now, only about 50% of teens regularly get that amount of sleep. There are basically three broad causes of this differential in or sleep deficiency. The first are kind of what you would expect, social and behavioral factors. Some of these include things that I care about and that I study, like screen time, scrolling through social media, excess caffeine consumption in the afternoon, or the pressures of daily high school, whether it's sports or homework. But there are bigger factors, and those are the structural factors, which affect schedules like school start time or work, after school work schedules. And school start time is really relevant to about 80% of teenagers in the US because over 30 years of research has shown that teenagers do better when schools start at 8:30 a.m. or later. And yet, as I said, only about 20% of high schools start at that time. We're moving in the right direction in that. Legislation in California has recently been enacted that requires schools to start at 8:30 a.m. or later, but we've got a long way to go. And then the third kind of big cause as to why teens aren't getting enough sleep is biology. Physiologically, when teens go through puberty, they experience a phase delay. And that means that their bodies naturally stay up later. It's not possible for them to fall asleep earlier unless they're so exhausted. They stay up later and they want to sleep in later. So this earlier school start time that a lot of high schools have is in direct conflict with their adolescent biology.
Thank you so much for that, Lauren. That's a lot of interesting information, I'm sure, for our viewers. And so we know that not getting enough sleep can significantly impact health. Can you tell us what you and other researchers have found, especially for the teenage population?
Absolutely. And it's a good point that it applies to everyone, but I'll mostly focus on teenagers for today's talk. So, or conversation. So, we know through, again, decades of research that insufficient or poor quality sleep is linked to a whole range of poor health outcomes, uh, specifically obesity, impaired immune function, depression, and overall emotional and psychological well-being. It's also linked to a range of poor social outcomes. And for teenagers, this can mean increased risk-taking behavior like drug and alcohol consumption, or for new drivers, unsafe driving. And so we see that, for example, early school start times is linked to higher vehicular accidents. And just by delaying school start times, you get a drop in car accidents. And so there's a public safety issue as well. And then the final kind of big outcome that insufficient sleep causes is performance markers, whether it's academic performance, grades, and performance on tests, or athletic performance. We see that more sleep leads to better performance. And one of my fun studies on this looked at the Twitter feed of NBA basketball players. And we showed that for players, if they were up late at night tweeting the night before a game, they actually performed worse on the court the next day. They scored fewer baskets and had lower shooting accuracy. So whether you're in it for the grades or the baskets, uh, sleep is going to help your next day performance.
So knowing these links between sleep and performance and health and safety, essentially, your research focuses on how disparities in sleep ultimately could lead to health disparities. And so can you give the audience a sense of how these are interconnected?
Absolutely. So this is sort of what got me interested in sleep to begin with. I was looking for underlying causes of health disparities in populations of all ages. And what we found is that sleep is socially patterned. And that means there are variations in sleep health by race, ethnicity, by socioeconomic status, by education. And we saw this in adults. And then we started to look at children's sleep patterns. And we did this by following a cohort called the Fragile Families and Child Wellbeing Study, in which they started collecting information on uh, participants at birth. They were all born between 1998 and 2000, and following up with them at ages 1, 3, 5, 9, 15. Now we're in the field collecting data at age 22. And we had some sleep data in the earlier waves, but at age 15 and now age 22, we're collecting actigraphy-based data. So we have objective assessments of sleep for age 15. We did it for 1 week, and we're able to kind of assess a range of factors and how sleep varies, how it's socially patterned in that age group. And to answer your question about racial and ethnic disparities, we found, this is kind of amazing, that Black teens sleep about 32 minutes less per weeknight and 41 minutes less per weekend night than white teens. And this accumulates over the week. So you can, when you think back to the negative consequences of insufficient sleep on health and performance, um, obesity, depression, you can imagine that sleep patterns set children and teens on trajectories that could lead to poor health outcomes and health disparities. And we also found that neighborhood mattered as well for disparate sleep patterns, in that more disadvantaged neighborhoods at age 15 had poorer quality sleep. And that could be due to either noise or light or safety, feelings of safety in the neighborhood. So there's a lot to unpack here, but it's a very important area for policymakers to think about.
Absolutely, very complex, but also extremely important. And so, since we're discussing children and teens, I want to pivot a little bit to conversations around screen time because I know the audience is very interested in this. Because the screen time is essentially spiked throughout the pandemic. So, how does screen time affect children and teens in terms of sleep?
Right. So, screen time is great. I love my screen time, so that this is personal to me. I know how hard it is to put your screens down. Screen time is great. Screen time is enticing, but unfortunately for us heavy screen users, dozens and dozens of studies have shown an association between later sleep onset, poorer sleep quality, and reduced overall sleep duration with increased screen use, especially among screen use right before bed and interactive screen use. So interactive would be doom scrolling on social media as opposed to watching TV from 10 or 12 feet away. So there are a few reasons why this association exists, and it's important to dig into the mechanisms, because without understanding the mechanisms, you don't know how to mitigate the effects of the mechanisms. The first is this physiological mechanism of the light emitted from the screen actually suppresses melatonin. And melatonin is a sleep promoting hormone informing your body that it's time to go to sleep. So if you have a suppression of melatonin because you're face to face with a bright screen, that's going to affect sleep onset, or when you go to sleep. The second mechanism is just the time that using a screen takes up, because when you're watching a video, you're taking away from time that you could be sleeping or should be sleeping, and or time that you could or should be getting ready for bed in a restful, relaxing way. And sort of the third big reason is the psychological effect, that the content of this is hard to study, of course, but the content of the screen could be disruptive to your thoughts before falling asleep. For example, imagine a 12-year-old girl looking on social media and seeing that 3 of her friends went out and she wasn't invited. That could lead to late night rumination, feelings of missing out, and really interfere with her ability to fall asleep in a way that allows her to get enough sleep. And the last point is one that we kind of just tapped into through the Common Sense Media data a couple years ago. We asked, how often do you wake up in the middle of the night to check your phone? And about, I think it was like 36% of teens report doing that.
Ah,
So, waking up in the night to check your phone is disruptive to your sleep. Even if you fall back asleep, it's probably something you shouldn't need to do.
Dr. Hell, that's some great information discussing sleep as far as both behavior as well as the underlying physiology. And these points are really important. And so, what would you like teens and parents to take away from this conversation?
Right. So again, this is a hard one. It's hard to get buy-in from everyone on this, but we need to think about the positive benefits that healthy sleep confers, and talk with your children and teenagers about why we value sleep and why we prioritize it by giving examples of the benefits of sleep, and then also role modeling healthy sleep behaviors, setting regular, consistent routines with healthy, calming, and relaxing routines like reading and dim lights. And then, the hardest one of all is saying, let's take digital media out of the bedroom. Do you really need your smartphone next to you in the minutes before you fall asleep? Do you need to use your smartphone as an alarm clock? You can buy an alarm clock that functions just fine, that doesn't have the internet attached to it. And not only doing that for your children or your teens, but doing that for the whole family. And we recommend setting up like a central charging place for smartphones, so nobody in the house is disrupted and checking their phone in the middle of the night or apartment. So those are the main recommendations. But as I said, it's hard to get buy-in on that because we are all so attached to our devices, and sometimes we just need a break, and nighttime's the perfect time for that.
Well, behavior change we know is extremely difficult, but being able to put out these recommendations, I think, is very helpful and could impact some of our members listening in the audience. And so we have reached our time. And so that's our time for today. Thank you, everyone out there that joined us. And thank you very much, Dr. Hell, for highlighting the important aspects of the science of sleep for children and teens. And so for more information and resources for the Science of Sleep series, visit www.nia.nih.gov/science of sleep. You can also continue this conversation online using the hashtag Science of Sleep. Thank you, everyone, and see you next week.